Hello everyone, I am Bachera Aktar. I work with Bragg James Beacon School of Public Health and Bragg University in Bangladesh. Now I will share Arise Hub experience in Bangladesh. Like most countries in the world, urbanization is also an inevitable phenomenon for Bangladesh. Each year, millions of people migrate from rural areas to big cities and towns in the country in search for better livelihood, shelter, education, and health. Currently, most urban growth is occurring in Dhaka city, the capital of Bangladesh. The city is now home to 18 million people, with around one-third of its population living in informal settlements. The rapid urban growth is bringing huge challenges for the cities throughout the country in terms of ensuring health and well-being of the residents living in urban slums. Inequity in service provision and resource distribution in those settlements is very much evident in our country. Urban informal settlements are very dynamic in our context. Even within informal settlements, there is diversity among the people living there, as some are ultra poor and some are relatively better off. There are also geographical and locational differences. Some slums are stable, others are grown on areas where already a plan exists for building infrastructures, like railways, mills, factories. Some slums are located in remote areas without basic facilities, whereas there are also some slums located comparatively inconvenient places in terms of transportation, where all the basic facilities are available and many NGOs work there. Slums are under one or more forms of uncertainties such as eviction, fire, and other types of natural and human-made disasters. Those settlements are most often also considered as the residence for criminals and source of diseases like diarrhea, dengue, etc. During the COVID-19 pandemic, the residents living of informal settlements also discriminated, being the hub of the disease spread for the city. Health and well-being of the slum residents is a burning issue which is mostly neglected in our country context. The urban health system in Bangladesh is very pluralistic, fragmented, and complex. Healthcare service delivery system is also very poor in terms of infrastructure and functionality. The residents mostly depend on informal healthcare providers like local drug shops, traditional healers, and NGOs are the key primary healthcare providers. Private sector is dominating secondary and tertiary level health services, which are often unaffordable and most often inaccessible to the poor slum dwellers. Unfortunately, there is no comprehensive urban strategy in Bangladesh, and existing health policies and strategies have not included urban slums and other informal settlements. The poor slum residents are considered as a burden and barriers to urbanization and only be remembered to the politicians during national and local level elections. Multiple actors are working for improving the health and well-being and living conditions of slum dwellers. However, the programs are working vertically with lots of overlapping services and areas, and at the same time there are also underserved areas. Coordination between different stakeholders is one of the key challenges in our country. City corporation as a local government institution is responsible for only providing primary healthcare services. However, there are other services like water and sanitation, livelihood, which are beyond the capacity of city corporation and which require support from other stakeholders. Urban health system in Bangladesh is a complex intersection between government, public, and NGOs and informal healthcare sectors. Lack of responsive accountability and inadequate governance structure are common in slums, which create multiple levels of compounding vulnerabilities for the urban poor. NGOs plays the main role in both development and health sectors in the slums. Unfortunately, NGOs are also reluctant to go to the settlements that are relatively unstable and located in remote locations. Therefore, the extreme poor and vulnerable populations living there are most often missed out. Dependence on donor fund and working in project approaches are main challenges NGOs faced. Once the donor phased out, mostly there is no sustainability of those service provisions. Lack of timely, accurate, and quality data from reliable sources is another challenge that affects evidence-based decision making. The National Health Information System lacks data on urban health, particularly of the poor living in the slums. Most of the available data are facility-based, and there is no segregation according to informal settlements in different locations of the cities. NGOs have their own project data, but unfortunately there is no provision of including NGO data in National Health Information System. Arise Hub in Bangladesh is trying to address some of the challenges that I mentioned earlier. We are trying to create an open space for the community to share their challenges, their experience, their needs and priorities. Through applying community-based participatory research methods, we are supporting community with co-creation of evidence and creating a platform for open dialogue between community and the key stakeholders. We also advocate for inclusion of local level non-health actors like ward counselors in health program plannings and decision making. And from the quotation here, you can also see that one of our community co-researchers also suggested a partnership and collaboration between multiple actors. Thank you everyone for patience hearing.